We did a session that had both conceptual frameworks and paradigms in the title, but we spent the entire session on paradigms and never got onto the conceptual frameworks. So in this session today, we're going to focus it on theoretical and conceptual frameworks, but we are just going to do a few initial reminder slides, just covering some of the topics that we did last time on paradigms. And the ethics part of this session, actually, we will not tackle today, but in 2 weeks' time, we'll do a session specifically on ethics at the front line of doing research in resource-constrained settings. And really, we'll be focusing now on ethics in the field and the kind of ethics that we all have to deal with every day, rather than kind of boardroom ethics review processes. So I'm going to kick us off with the reminder slides on paradigms. I'm not going to try and cover it in anything like as much detail as we did last time, but the recording is there if you'd like to see that. And I'll add a couple of new slides in there just to help to hopefully bring it close to home in terms of some of the implications of different assumptions for our research studies in health policy and systems research. And Shobhana and Caroline will then take over the theoretical and conceptual frameworks section, which will be the main part today. Okay, so just a couple of reminder slides of what we covered last time. We talked about all of us implementing, designing, being involved with various different research strategies. And a research strategy includes all of these different elements in the center of the big box there. So carefully thinking about what are our questions, thinking about who we want to talk to, what we want to measure, the sampling processes, the types of methods that we're going to use. And often even from the outset, we're thinking about what kind of analytical approach are we going to use? How might we present the results that we're finding? Many of these elements are kind of brought together in a research design, and there are many different designs out there. For example, ethnographic designs, different types of case study designs, all sorts of different approaches to doing evaluations. And we've heard and had sessions before on, for example, mixed methods process evaluations. The important thing that we were covering last time is that all of these elements of a research strategy are very much shaped by our understanding, our assumptions, whether we're conscious or not of this, of what it is that we're studying. And these are essentially philosophical assumptions. So assumptions about what reality is, about what counts as knowledge in order to understand that reality, and about the values that a researcher can or should bring to a particular study area. So that's about ontology, it's about epistemology and axiology, those three top areas of philosophical assumptions, and we covered that in detail last time. These assumptions influence the research paradigm or interpretive framework, the lens, the way that we look at a problem that shapes all of the rest of our elements of a research strategy. And these types of philosophical assumptions and the research paradigms or interpretive frameworks that are embedded within them are very much influenced through our training, our basic training that we go through, and also by our academic environment that we're working in. These areas, consciously or not, really shape our philosophical assumptions and the research strategies that we take and implement. So we talked last time about two dominant and contrasting overarching paradigms, and pulled them on this diagram to show the kind of extreme ends and to make the point of highlighting some of the contrasts. So on the left-hand side of my slide, there's a positivist paradigm, and the basic assumption here is that there's a single reality that exists out there that's independent of human experience, and that a researcher can know this reality. And the best kind of methods to know this reality are the more experimental or quantitative methods. And the role of the researcher here is really to be absent. So of course the researcher is there and their expertise, and it's their understanding of the reality that is seen to be really key here. But the methodological approach tries to make sure that that presence is unbiased or controlled for. At the opposite end of the spectrum is a more interpretivist paradigm. And here the understanding of reality is really different, the understanding here is that there are multiple realities, that realities are complex, they're multi-layered, that a single phenomenon might be understood very differently by different people. Certain people might even look at that phenomenon differently in different contexts, so if they move place or have a different contextual experience. These realities are constructed through experience and interactions, and the researcher, far from being absent or unbiased, is actually involved in helping to construct those and influencing those realities. And so it's really important in the research that's done to understand the complexity and depth of all of these different perspectives, that the role of the researcher is recognised and discussed as part of good quality research. So to understand this complexity, the role of context, etc., qualitative research methods are generally considered to be more appropriate. There's an inductive form of reasoning for a more interpretivist paradigm, as opposed to deductive with positivist or post-positivist. So an example of these two ends of the spectrum are thinking about TB on the more positivist or post-positivist side. TB is caused by TB bacillus, and the idea is that people either know or don't know that cause. On the other side of the spectrum would be an understanding that TB is really constructed and understood and has very different meanings in different places and for different people, depending, for example, on wealth and gender. So we gave that just to give a bit of a layout of those two perspectives, recognizing that actually there are many kind of books that have been written on philosophical assumptions. There's a lot of contest, there's a lot of different ways of thinking about this, but this was really just to show some of the different ends of the spectrum and to highlight those differences. And just to point out that quite often, for instance, in medical training, there's a positivist or post-positive set of assumptions and paradigms that are built into the training, and often not in a way that's conscious or openly stated in training. So in our last session, we went through these different paradigms in the left-hand side of this table here. And we went through each of them in turn in detail, looking at the ontology, the emphasis and the epistemology, and the different type of reasoning brought to the analysis. So just to talk about it very, very briefly here, those first two rows I've just talked about now, really. So with the positivist and post-positivist paradigm, there's that idea that a single reality exists out there. From the perspective of the researcher, that kind of knowledge has to be objective. It can be understood with the right techniques. Whether or not the knowledge has been achieved is tested and validated by peers rather than participants involved in the research. And the reasoning is more deductive, empirically and scientifically studied. With social constructivism, that's on the other end, that's the more interpretivist perspective. And this is the one with the multiple realities being constructed through experience and interactions. And here it's trying to really understand that experience, different perceptions, and it can involve being as close as possible to those people's lives in order to understand the richness and the detail and the depth. And here the reasoning is inductive, ideas emerge over the course of the research, and the type of writing style is often even quite different, and the way that papers are written and structured. With transformation and critical paradigms, we talked about these being quite related to each other, but here there's a real attention to understanding reality as being reflective of inequities in social relationships, in power, and that reality is based on struggles, including over that power and on identity. in society. So with transformation, the key element here is that often there's co-creation of knowledge together with participants in collaborative processes. And with a more critical paradigm, it's very overlapping, obviously here, but with a critical paradigm, there's not necessarily co-creation, but there could be, through new theoretical understandings and so on, challenges to inequities and current societal organization. And then finally, with pragmatism, we talked about this not being particularly wedded to one side of that spectrum on the previous slide or the other, and that this is increasingly with more applied work being used. And this is thinking about the nature of reality being about what is useful and drawing on what works to be able to answer a particular research question. So a couple of new slides, and just to sort of bring this to the fields that some of us might work closely in. Health policy and systems research is a very applied field, with whether or not something is in health policy and systems research question being defined really by the question it asks, as opposed to a particular paradigm or a particular methodological approach. And a massive strength of the field is that it's seen to bring together multiple paradigms. So if we think about health systems in our research, the way that we view social reality influences the way in which we understand what health systems are and how we study them. So on that, using that spectrum again, we can see on the left-hand side here that a post-positivist approach would think of health systems as kind of really complicated machine-like organizations that you can really understand if you're clever enough and looking in enough detail. And you can conduct interventions, implement them through changes introduced at the top, through, for example, putting new rules and incentives through the health system to achieve new outcomes. At the other end of the spectrum is a more interpretivist view of health systems, and here systems are seen as complex social and political phenomena. So with people at the heart of them, their perceptions and their actions being in some ways unpredictable, and the power relations between people, the relationships being really key to understanding what health systems are and how they function. So it's just to reiterate really how the philosophical assumptions can feed through to our thinking and our research questions and our methods, that entire research approach. And just one more example, what we can see is that our views of social reality can also influence the kind of research design methods or how we apply theory and theoretical frameworks, and we'll come on to this through the rest of this session. But for instance, in terms of a case study design, people have written about and promote a form of doing case study designs that can come across that spectrum from a more post-positivist to an interpretivist approach. So, for example, Yin talks about mixed methods and careful use of mixed methods being able to get as close to reality as possible, and that might be seen to fall more to that left of the spectrum, whereas others are taking a more qualitative understanding and approach to understand the depth and complexity of meaning of a certain topic in different contexts, including taking seriously the potential role of the researcher in making up that context and in the evidence that's produced. And there are also combinations of different research paradigms and tools in different academics' approaches to this type of design. So I think the key point here is to be thinking about paradigms and how they influence the case study designs and the different methods, and making sure that the types of approach that are being used are appropriate for the particular study or question that's being planned or reviewed. So that's just a quick overview of what we covered last time, with a few new elements. And just a reminder on social theory, we talked about this being a way of understanding human interaction, a way of explaining phenomena. And so a good way to kind of distinguish these from paradigms is that while paradigms can point out a general direction, theories can map out an explanation, the whys and the hows, and even the hows behind the whys. So for instance, interpretive paradigms might, in the way I just described, talk about health systems as socio-political phenomena or be interested in that. But it doesn't really help us understand the whys and the hows and what that means. So intersectional theory might help us to achieve that more. And this theory is about, and we talked about this last time, but how people's identities, perspectives and experiences can be very much shaped by their social locations, different elements of that which interact with each other and intersect, and the situational and structural drivers behind those identities, perceptions and experiences. So really, theory provides a structure to think about the data, to think about what it means, to analyze and work through what you're collecting. And in terms of how theory is actually applied in practice, it could be that a certain theory is tested, and the whole study could be designed around testing how applicable or effective a particular theory is. So, for example, it might be an assumption that maternal education is associated with treatment-seeking behaviour, and this could inform how the study is designed and implemented. Theory can be applied in studies. So, for example, this is different from actually testing to see whether a theory holds true or not, but it's applied so that the different constructs of a theory help to influence the kind of tools that are used and the way in which the study is rolled out, the data that's collected. An example we might hear about here, for instance, is COM-B or NAS that we've been thinking about, if and how we can apply that in some of our research. Research might be informed by theory, so it's not so much that a theory is taken and applied through a study, but more like it helps to guide and to make sense of the data as it evolves. And theory might actually be built through research. So here the theories, the ideas, the thinking is developed at the same time as the data collection and is resulting from and emerging from that data collection. So that's gone back over what we covered last time with some new elements, and just handing over now to you, Caroline, to take us forward into the conceptual and theoretical frameworks.
Okay, so just moving on from what Sass has been saying, getting to sort of the nub of this presentation, thinking about what do we mean by conceptual and theoretical frameworks. This can cause a lot of confusion, and many researchers do use the terms theoretical and conceptual frameworks interchangeably. But in scientific and academic terms, a theory is different to a concept. So Sass has just been talking about what theories are, and they are an explanation of an observed phenomena. So you have a theory about how something works or why it works in the way it does. So it sort of specifies actions and interactions in quite a bit of detail. Whereas a concept is a construct or an abstract idea. So you may start off with a concept and from those conceptual ideas develop a theory. So it may underlie the development of the theory, or a combination of theories may lead to the development of a new concept about the way something works. Next slide, please. So people can use either theoretical or conceptual frameworks in their work. as Sassy just mentioned, theoretical frameworks can be used in many different ways in research. And the example here of the COM-B framework is a theory that serves as the basis for conducting research. So it's an example of applying theory. So you have the theory, the COM-B theory, which is a theory about behavior in systems. And you look at the components of that framework to decide how you're going to conduct your study and what you're actually going to look at. However, such an approach may not always be appropriate for qualitative studies. And quite a good example of this was a study that was undertaken in Nepal on diabetes and influences on behaviours in relation to diabetes amongst diabetics and family members, where they used the COM-B framework to frame the questions they asked and to frame the approaches that they took. However, can we have the next slide, please, Sass? However, so this is the paper, Developing a Socio-Ecological Model of Dietary Behaviour for People Living with Diabetes. What they started off with was the COM-B model to investigate experiences. I don't know if you can see this. It's very, very fuzzy on my screen. I hope you're seeing this a bit better than I am. When they started applying the very specific aspects of COM-B in terms of motivation and behaviour, they found that it wasn't really adequate to fully structure their findings. So they found that even though COM-B has something like 72 different facets that you can look at to construct your model, that it oversimplified the multifaceted nature of the opportunities in the COM-B model, because it didn't take into account all of the different contextual factors that influence people's behaviour, and that these factors change, not just, you know, on a daily basis and relative to which social context you're actually in. So what they did then was they took a step back and went back to a more conceptual model, which is the socio-ecological model, to develop a new framework. So the socio-ecological model, which I think many of you are aware of, is how the social and cultural context, the physical environment, the political environment and individual environment will influence the behaviours that you're investigating. You quite often see the socio-ecological model presented like an onion, where you have the individual in the middle, and then you have the family, and then you have the community, and then you have the global. Now, what that is doing, for me, that is more of a conceptual framework, because it's not giving you any directionality. It's not suggesting necessarily how one influences the other. But what it's saying is that conceptually, these are the things that will influence each other. Whereas, for example, the COM-B model is much more directional. If you alter this, this will happen. If you put the brakes on, the car will stop more slowly or less slowly, rather than the brakes are an integral part of the car. So it's a much more detailed framework, a theoretical framework, such as the COM-B framework. And what the authors of this paper, based in Nepal, did was that they looked at the various contextual factors that were influencing people's behaviours in relation to diabetes or high glucose levels, and came up with this new conceptual model, which provides you with a way of thinking about the problem, but doesn't necessarily provide you with, this is how the political environment specifically will affect the individual environment, and if you tweak it in this way, it'll happen in this way. We need to think about this political environment, and we need to consider what things might influence the individual environment. You may then want to develop a theory about how political environment affects individual environment, but at this level, as it's presented here, it's more of a conceptual model, because it's not thinking about how those links necessarily function. I'm not sure if we want to just, perhaps we better wait till the end to ask questions, but that's just an example of how a theoretical framework started in the study. Then the authors discovered that applying that theoretical framework, they needed to take a step back because they realized that their theoretical framework didn't fully explain everything that they were seeing, and they weren't able to develop a new theoretical framework. So they sort of stepped back and said, okay, this is what's happening. Let's think about this at a more conceptual level. And then in subsequent studies, you might want to redesign a new theoretical framework. But I'm now going to hand over to Shobhi, who will describe her work in which she used a theoretical framework effectively to explain what was happening. So Shobhi.
Thanks, Caroline. Thank you. Thanks, Caroline, and thanks, Sass. As Caroline mentioned, I was just going to speak a little bit about normalization process theory. So NPT is a theoretical framework. It's a mid-range theory which actually looks at the work that different stakeholders do in order to implement a new practice or a new intervention, and then tries to explain how it's implemented, but also comes to be embedded and then integrated into a health system. And the reason why I chose this particular theory was I was really interested in the fact that lots of complex interventions are proven to be of benefit through trials, but hardly any actually get taken into practice and routinized into day-to-day practice. So this theory was really addressing that aspect of work and how things actually get embedded into day-to-day practices. Just to give you a bit of background on how NPT can be used, it can be used to support intervention design, in particularly to understand the context. And that's because of the constructs that have been embedded within that theory. They actually look at the different areas in which the work that people do can actually effectively implement that new intervention into the day-to-day practices. And so if you're looking at it, developing an intervention, it's quite useful to then go through those different constructs and then gear your intervention so it will be implemented in the future. It can also be used in terms of looking at process evaluation of trials. So again, explaining how a particular intervention or a particular new practice was actually implemented during the trial. It can also be used as a framework for systematic reviews and also for questionnaire design. There's a really wonderful website called normalizationprocess.org. And if you go to that, it goes through all the constructs and it even has the questions to ask for each of those constructs. And you can almost use those in terms of feeding into your questionnaire design. So there's some examples on that website for that as well. Most often, NPT is used in a type of framework analysis. So the 4 constructs are used to look at qualitative data to actually put into those 4 different construct categories and then try and explain some of the barriers and enablers around implementation. And the other way it can be used is in terms of a theory-led analysis, and that can be used to inform your qualitative work and analysis, but also to allow some room for other kind of concepts to emerge. And as Caroline mentioned in the study that was done in Nepal, how these types of frameworks can be quite constrictive sometimes, and you feel that when actually you get into the field and you start looking at your data, it doesn't neatly fit into these categories. And that's definitely something that I found as well. And so I found having this ability to kind of be flexible with theory was really important. And I spoke to Professor Carl May, who's sort of came up with this theory, NPT, and he also said you can use it however you want to use it. It's just there to guide you. And I think taking that type of approach and being flexible is a really good way to go about using theory in the work, because some things do emerge outside of the constructs. Sassy, okay to move on to the next slide? So just to go through some of the 4 constructs in NPT, this is really looking at how people work together and individually in order to implement an intervention and then make it part of their day-to-day work. So it came from the synthesizing of different theories of implementation in an iterative way. And so the first thing that's needed when you're introducing a new intervention into a health system is that actually people need to understand what the intervention is, how it differs from their previous practices and work, and actually think that, oh, this intervention is going to be of some value and benefit to us. And that's about coherence. It's understanding and making sense of the intervention. And once people have done that within the health system, then some work is needed in order to actually initiate the intervention. So actually some buy-in from people around it, and also the people who are delivering it need to make other people in the health system and other stakeholders also feel that the intervention is important. And so there's this idea of initiating an intervention, enrolling people and having some legitimacy around that intervention, which then helps with implementation. And that's the cognitive participation part. After that, people need to actually work to operationalize the intervention. So this is where people start negotiating their roles. That's where the professional hierarchies and things come in, and how people start redistributing tasks amongst each other. And that's about the division of labor and resources as well. And then finally, people need to be able to actually appraise the work that they're doing, both individually, see that it's had benefit to them or some of the problems that they've had around it, and communally as well as a collective. They need to know exactly how the intervention has impacted their day-to-day work and whether they're going to adopt it as part of their routine work. And so these four constructs are at the heart of NPT. And you can see that actually, if we were to design an intervention around these four constructs, we're much more likely to get it implemented in practice. But also, those four constructs can be used to explain how an intervention has become embedded or implemented as well. Thanks, Sass. So a lot of people have used NPT in terms of looking prospectively and designing qualitative studies, but also it can be used retrospectively as well. And so in terms of determining the initial research focus and research questions, you can use NPT to actually trigger some of those research questions about how do people understand an intervention? How do people come to actually work together in a team to implement an intervention? And then how do they actually appraise the consequences of what they're doing? And so those could actually form the basis of some of your research questions, but also can guide the sampling strategy. So by thinking through those four constructs, you can get an idea of who's needed to work together, and actually from that get your stakeholders that you want to interview or to have focus groups with. You can also use those constructs in terms of developing the topic guides for interviews and focus group discussions, and think about how you can actually look at the work that people are doing. And that might not be just through interviews and focus groups, but it might be that actually you want to capture some of that visually in terms of video and photo diaries, and also narratives of people going through a particular journey in terms of the work that they're doing. And then finally, as I mentioned before, it can be used as a framework for coding and analysis, and also to interpret the findings, to actually think about, actually, these were the factors that actually helped in the implementation of my intervention, and these were the ones that that didn't quite fit, and we need to work on. Thanks, Sass. So I was just going to just illustrate a couple of papers that have used NPT. So this is a paper by O'Donnell and her team, who actually looked at using brief interventions for alcohol screening in primary care, and they used NPT as a framework for a framework analysis. So they did the interviews and then they used those four constructs, and through that they were able to actually put together some ideas around how this particular intervention had come to be implemented in primary care. Can we go to the next one? And there's also numerous studies using NPT in terms of process evaluation and looking at how interventions came to be implemented or not implemented, and what those barriers were. And there's also more of a quantitative tool called the NOMAD instrument, which has synthesized those NPT constructs into 23 different kind of domains in a questionnaire. And this is a really good instrument if you're wanting some quantitative measurement of implementation. And so it's kind of synthesize those constructs and made them into something that you can measure and then look at how things are implemented. So it's going from, as Sass mentioned right at the beginning, it's taking some of those empirical things right from that interpretivist and constructivist end of the spectrum, and it's kind of almost bringing it into a more quantitative paradigm. So you know, a lot of people don't feel very comfortable with that, but it's just to say that that's out there. And if you go to the normalizationprocess.org website, you can see these different items on the NOMAD questionnaire. And what I found is that those are quite useful when you're actually planning your study or planning a trial, to actually think about those elements before you go ahead with it, so you can actually think about incorporating some of those elements. And then finally, the next slide, there have been studies that have actually used NPT retrospectively. So this is a study of an app that had already been developed and trialed, but they went back to the original data and actually looked at it retrospectively. And one of the authors was also on the original NPT paper. And so this was an example of how normalization process theory can be used retrospectively to look at, as a lens to look at how things were implemented as well. So that's just a very short and practical guide of how NPT can be used. And just to say as well that all of these theoretical frameworks and theories, they're just guides really. And often when you get into the field, there are things that don't quite fit. So as Caroline mentioned, I'd used COM-B and NPT in my work, and I found exactly the same as that team in Nepal, that actually COM-B didn't address the social opportunities in the depth that I would have really wanted for the context I was working in. I did find, however, that NPT did really help to explain implementation, and it made me think of things that I hadn't thought of before. But I did find it hard to sort of categorize things in those 4 constructs sometimes, because they kind of span across different aspects. So that was just my experience of using NPT, and I hope that's been useful. But I'd signpost you to the normalization process workshop and website. So I will hand back over to Sass now. Thank you.
Actually, it's to Caroline, I think.
Caroline,
Thanks so much, Shobhi. Yeah, we're doing a bit of a triple act today.
Cool.
Sorry, I think I'm doing this one, and then Sassy's doing one, and then it's back to me again. Cool. Anyway, so as Shobhi said, I mean, I think, you know, one of the key things is, do we actually need a theoretical framework to start off with? As Shobhi has said, you know, in her work, she found it extremely useful, and it can be very useful indeed, depending on the type of work you're doing. It can help you, particularly if you're applying a framework, to help you think through what it is that you want to do. And theoretical frameworks may also arise from the data. So, for example, you see something happening and you think, oh, actually, I think if I can use this theory to help explain what I'm seeing. So it's not that you go into your research with a specific theory in mind, but it can be that when you start analyzing your research, you read a lot and you understand from how other people have interpreted their data, you may find that there are some theories that actually you think, oh, yes, this really helps explain what I'm seeing. Or if I combine these 2 theories, it will help explain what I'm seeing. The point about theories and theoretical frameworks is that they're constantly evolving. Very rarely will you have in social theory, does the theory last for more than about 10 years, and then they evolve as people work on them, with them, and through them. As I just mentioned, you may find that there's no single theory that helps explain what you see. So, for example, if you're looking at antimicrobial use, you may find that the lens, a theoretical approach or lens, such as a power lens, together with theories such as antibiotics as infrastructure. So there's a social theory around antibiotics being an infrastructure that underpins a particular form of health system and helps it function. And using that together with a power lens can help you analyze and interpret your data without actually producing a single theoretical framework. So you don't have to have a single theoretical framework. You can draw on a range of theories to help explain your results, what you see. I'm handing over. Sass is going to just describe the next slide, because this is an example of a realist evaluation, and Sass will talk about how theory was used in this particular study. Over.
Thanks, Caroline. I'll just talk about it really briefly to mention that with kind of realist review and realist evaluation processes, basically the whole process involves, first of all, on the basis of theories, on the basis of literature reviews, consultations with relevant people, an initial program theory can be developed, and through the process of a realist review or an evaluation, that theory is added to, evolved, changed, and rewritten. So it's just another illustration, really, about how theory can be developed and applied. And there'll be others on this call who are much more experts in realist reviews and realist evaluations than I am. But this is just one example here of a theoretical framework that was the result of a realist review of the community engagement literature. And here, the overall finding, what this framework is trying to show is at the core of community engagement activities is the development of working relationships in the middle there. And so it's trying to explain the range of aspects that feed into and build up those working relationships. So those more purple circles around the outside, the exchange and negotiation of mutual benefits, researchers' responsiveness to what other stakeholders are raising, the extent to which those stakeholders feel listened to and have their concerns acknowledged, the responsiveness, the extent to which researchers, are actually living in and embedded in and form relationships with community members, so build contiguity and familiarity with those various different stakeholders, and that these different interrelated areas are in turn shaped by the culture of engagement in a particular research institution, and in turn that is shaped by the global health research paradigm, which is imbued by various inequities and power relations locally and globally. So that's just an illustration of a theoretical framework that's evolved through a realist approach. Thanks, Caroline.
What we've talked about quite a lot so far is theoretical framework. So we're now just going to spend the next few slides thinking about what is a conceptual framework and what the differences are. And some of you may feel that in fact the differences aren't that big, because a conceptual framework can also be the basis for thinking about what the research is about and been influenced by the ideas and the research of others in the same way that a theoretical framework is. It can also, it's also useful as an organized way of thinking about how and why your project takes place and how the researcher understands its activities. I think the key difference here is that with the level of abstraction in a way that we're talking about. As we've already mentioned, the theoretical framework, so things such as the normalization process theory framework, has a very detailed description of how things fit together and how they work together, to the extent that you can develop a framework that will guide the questionnaire with the specific questions that you will need to ask in a particular project. A conceptual framework is at a much higher level, if you like. It actually is more about guiding inquiry and thinking about the areas or the spheres of influence that you need to think about, rather than helping you specifically design the questions for a questionnaire. You may adapt a conceptual framework that's been used in a previous study with modifications to suit your work, or you might come up with a completely new conceptual framework. Next slide, please, Sass. What a conceptual framework does is it tends to, unlike a theoretical framework, it tends to reflect the researcher's own position on the problem and gives direction to the study. So you're not adopting someone else's theoretical framework. What you're doing is you're saying, okay, for me, this is my interest, and this is how I think that I want to address this problem. It's a set of coherent ideas or concepts that are organized in a manner that makes them easy to communicate to others, which is another reason for often doing it in a diagram, because diagrams are often a lot more easy to interpret than a lot of words. A conceptual framework should show the relationships of the different constructs or factors that are going to be investigated, and these relationships can sometimes be based on theories. So it could be, for example, that you have a theory of intersectionality, so you think that the relationship between a husband and wife may be influenced by gender, by social context, by socioeconomic status. So some of those construct or factors might be influenced by your theoretical lens as well, or your theoretical framing. However, it doesn't necessarily include theories or explanations, but it's rather a broad framing of what might be important to look at. And it may be that you end up looking at something a little bit differently. Next slide, please. So the framework can help you identify the information required. So in the same way that a theoretical framework will inform what you're supposed to look at and how to look at it, your conceptual framework will help identifying what information needs to be gathered in order to answer the question you're asking. And it can also be used to help think about which methods to use to answer the research question. Next slide, please. So this is an example of a conceptual framework from one of our early career postdocs here in the Can We Work and Trust programme that she developed for her PhD. And the diagram on the left arose out of readings about what might influence neonatal care practices in hospitals in Kenya. So based on her reading, on her literature review, this range of factors, the social, economic and political context, the health system philosophies, hospital paradigms of care, the hospital structure, organizational management, the community and family support, all of these things might influence this central square of the practices of care. And then also the specific issues that she was interested in looking at within the practices of care was that the communication and also dignity and respect. So were the mothers and babies treated with dignity and respect? Was there information sharing? How much collaboration or participation was there? And this was informed by the concept of family-centered care. So she had a concept of that care should be family-centered, and her conceptual framework around what would influence the practices of family-centered care in this particular environment came from her reading of the factors that influenced what influences the provision of care within particular health systems. At the end of the project, and so her focus was on the square in the middle, but with some looking at the outside. At the end of this was an ethnography, and by the end of the project, she hadn't the theories around what was happening in terms of dignity and respect, for example. Her interpretations drew a lot on the theories of Bourdieu, of habitus. So how you behave and how you act is a consequence of your environment and context. Also on theories of power, using a Foucault lens, and about relationships between nurses and patients. But her conceptual framework that she presented at the end didn't include the theories. What it included, well, it didn't describe them, but you can see the red line going from social, political, cultural and economic context down to dignity and respect. So what she found was that this context really influenced dignity and respect, and then used theories of power, used theories of structural vulnerability to explain how social, cultural and economic context was affecting dignity and respect. So this isn't a theoretical framework that she ended up with on the right. It's still a conceptual framework, but you had theories that explained what was going on in each of these red lines. Next slide, please. This is another example from another PhD student that Sassy and I supervised, who did work on nutrition and the use of nutritional interventions in Kilifi. And again, you can see that what's happened here from the left to the right. The left was developed prior to the research, based on the literature review, thinking about what are the things that might influence the uptake and use of interventions. And then on the left, sorry, the other way around, the left is that, and then on the right is the conceptual framework that she ended up with. And again, what she found is, you can see there's a lot more detail about the sorts of influences that might be happening, and her broader theory that she drew on to understand what was going on was around structural vulnerability, and looking at the underlying structural influences that influenced all of these other things that were going on. So you still have a conceptual framework, but you have a theory that has been developed through the research that helps explain what might be going on inside those boxes, but not in the same detailed way that you would have in something like in the normalization process theory. Okay, next slide, please. And again, I think that probably, oh, something's happened to my screen. Thank you. That probably relates to this idea of sort of a detailed explanation, which is sort of heading towards the sort of post-positive side, about trying to understand and describe reality rather than a more social constructivist approach to thinking about what are the sort of core influences rather than specific necessary pathways. So in conclusion, all research is based on underlying philosophical assumptions and paradigms, as we reviewed at the beginning of this talk. A priori, theoretical frameworks may be useful, but they also may be too prescriptive in some types of research. Conceptual frameworks are a useful tool too, as well, and because they can show the relationships of the different constructs to be investigated without necessarily being prescriptive about how you expect those things to work. So they can help show the direction of the study, as I say, but without being too prescriptive about how you expect things to work. They can help decide and explain what will be investigated and how, and what's been learnt, in the same way that theoretical frameworks can. But they can also contribute to developing theories about what's going on, and theoretical frameworks that will explain what's going on in more detail and perhaps with more directionality.